What should you do after a concussion? Concussions are very common in sports, car accidents, and other head and neck injuries. There are many myths and confusion about how to care for your brain after you experience a concussion. Many people don't realize the severity of even a mild concussion and that they can be caused by a direct or indirect hit to the head or body. Not all concussions are suffered by athletes while playing sports. Falls and accidents can cause them too. All concussions are serious injuries that can have severe repercussions if not managed properly. Proper care during the first 7 to 10 days is crucial to ensure your recovery. The recovery process. Step 1. First, 3 to 4 days of physical and cognitive rest is critical. No driving, no screen time, no reading, no school, no homework, and no physical activity. Rest in a dimly lit room with minimal stimulation. When you no longer exhibit symptoms for at least 24 hours, you can move on to step 2. If after 4 to 5 days you are still symptomatic with complete rest, return to your upper cervical chiropractor for reevaluation, or find an upper cervical chiropractor near you. Step 2. Light cognitive activity allowed. You should still be resting for the majority of the day. You can attempt to read a book or do homework for a 30 to 45 minute daily maximum. If symptoms occur during or in close proximity to the cognitive activity, this is considered a failed step. You must go back to step 1 for a minimum of 24 hours. If no symptoms occur after 30 to 45 minutes of cognitive activity, you should still discontinue the activity for the remainder of the day. The following day, you can proceed to step 3. Step 3. You are now ready for a half day of work or school, but keep in mind, this means no driving, no homework, no recess, no gym, no manual labor or heavy equipment usage. This includes power tools and saws. If any symptoms arise while at school or later in the day, you must return to step 2 for the following 24 hours. If no symptoms occur, you can move on to step 4. Step 4. This step involves exactly the same recommendations as step 3, but you may attend work or school for the full day with restrictions. If any symptoms occur, you must return to step 3. If no symptoms occur, you may proceed to step 5. Some accommodations that should be made during this step include allowing for frequent breaks, no tests or heavy thinking, and have another student take notes. Limit yourself to 50 to 70% of the normal workload. Do your best to avoid overstimulating environments, crowds, loud noises, and jostling in crowded hallways. Step 5. Slowly start removing restrictions and prepare for a full return to school or work as tolerated. It is recommended that you lift 1 restriction per 24-hour period. If no symptoms are provoked, continue to lift 1 restriction until a full return can be tolerated. Step 6. A full return to work or school with no restrictions. Driving is now permitted. Physical activity should be kept to light walking or gentle range of motion exercises until you have fully reintegrated your normal daily activities. At this stage, another evaluation should be done by your upper cervical chiropractor to begin the process of returning to full physical activity or sports. Concussion injuries are typically divided into 2 categories: primary brain injury and secondary brain injury. Primary brain injury is the initial injury to the brain caused by trauma. Secondary brain injury is any damage to the brain following that initial injury and is typically because of physiologic changes to the brain. These changes commonly include decreased or altered blood and cerebral spinal fluid flow and can lead to many symptoms. You cannot have a head injury without an upper neck injury. The upper neck is the weakest and most complex region of the spine due to its wide range of motion. Therefore, it is the most susceptible to injury and misalignment. The upper neck is like Grand Central Station because cerebral spinal fluid, blood vessels, the brainstem, and many other key nerves pass through this very crowded area on their way from brain to body. Pressure on these delicate structures can lead to a host of symptoms, including recurring headaches, dizziness, nausea, fatigue, loss of balance, memory loss, poor sleep, light and sound sensitivity, concentration issues, personality changes, anxiety, depression, and irritability. An upper cervical correction procedure is a very precise, gentle, and sophisticated procedure to correct misalignments in the upper neck without any twisting or popping. This procedure is the missing link for many people who are suffering with lingering concussion symptoms. Dr. Jean-Paul Bohemier is trained in upper cervical care, a specific procedure designed to detect and gently correct atlas misalignments. To learn more about upper cervical care, call us in our Calgary office at 403-266-2283 or visit our website at www.drbohemier.com.